My name is Sarah Miles. I'm in Calm 131, and this is the rehearsal video for my informative speech. What if I told you that cancer could be treated and prevented with something as simple as light? Well, that's the fundamental principle behind a treatment known as photodynamic therapy, or PDT. After doing extensive research on the subject, I can confidently tell you that photodynamic therapy is a medical innovation that has been developed over the past few decades to effectively treat and prevent certain types of cancers. Today, I will talk to you about how photodynamic therapy works, what it is used for, and some possible uses in the future. In order to understand how photodynamic therapy works, one can simply look at the name. It comes from the Greek roots, photo, meaning light, and dynamic, meaning power or force. According to the American Cancer Society, photodynamic therapy uses special drugs called photosensitizing agents that are activated by certain kinds of light. These drugs can be applied transdermally or injected intravenously. After waiting several hours, blue light is shined on the treated area to activate the drug. Blue light is used due to its higher frequency and smaller wavelength, allowing it to be more easily absorbed by cells and remain in cancerous cells for longer amounts of time. According to the American Society of Dermatologic Surgery, photodynamic therapy uses a combination of drugs and light, and this activates a specific oxygen molecule, which then releases a chemical, allowing nearby cells to be destroyed. After several days, the treated area is then re-examined to determine if further action is needed. This type of treatment has many benefits, and the American Cancer Society notes that the primary benefit is that it is much more cost-effective and less invasive than surgery, which has many associated complications and risks. Another benefit noted is that it does not take very long to perform and can be repeated as many times as necessary in the same area, unlike other more harmful treatments such as radiation therapy. A third treatment is that this is a very specific type of treatment in the sense that it can target individual cells and areas. Photodynamic therapy is not perfect, however, and does have several limitations. One of the limitations mentioned by the American Cancer Society is that it is only able to treat areas easily accessible by light, such as the skin and hollow organs. Another drawback that is often found with this type of treatment is that it is unable to treat cancers that have spread to the rest of the body, or late-stage cancers. Because of this, it is primarily used as preventative and early-stage treatment measures. Now that I have discussed how photodynamic therapy works, I will discuss its current uses. As I mentioned, it remains longer in cancerous cells than in normal cells, and it is primarily used in the skin and in luminal or hollow organs. According to research done by the National Cancer Institution in 2011, it was effectively used to treat esophageal and certain lung cancers. The photosensitizing agent used in these experiments was porphyrin sodium, also known as photofrin, to treat lesions in the throat and airways. In this way, photodynamic therapy was used to treat cancer. It was also found in these tests that photodynamic therapy could treat Barrett esophagus, a precancerous condition. In this way, photodynamic therapy was used as a preventative measure. Other tests performed in 2007 by Dr. Amy Foreman-Taub proved how photodynamic therapy can be used in other treatments besides that of cancer. Some examples that she found was the successful use of PDT to assist in immunological disorders and inflammation problems. Other things that she found associated with photodynamic therapy was the reduction of pathogens associated with sebaceous glands. One common pathogen that we all have experienced at some point in our life is due to the pathogen that causes acne. So by this research, we can tell that photodynamic therapy has other uses besides just cancer. Now that I have talked about photodynamic therapy's current uses, I'm going to talk about some possible future uses. According to the American Cancer Society, there is research being done currently about the use of photodynamic therapy in the stomach, the pancreas, even the brain. And this is significant because these areas are not easily reachable with light. And so this is a new frontier that we're exploring. A more recent study was done on how photodynamic therapy can help with HPV, also known as human papillomavirus. In 2017, the CDC noted that human papillomavirus was found in nearly 79 million Americans, most of which were in their teens and early 20s. That's all of us in this class. A 2017 study was done on the use of photodynamic therapy in HPV, which can lead to cervical cancer in many women. This study, although still needing to be peer-reviewed, had significant findings. Within 1 year, about 80% of women were able to clear their HPV infection entirely, and that 60% saw a regression of their cervical lesions. This is significant, and while it does require further testing and analysis, and is not quite a cure, these findings allow for the removal of precancerous tissue, the prevention of further cervical cancer, and allow women who are infected with HPV to have children. Today, I have spoken with you about how photodynamic therapy works, what its current uses are, and some possible applications in the future. By looking at photodynamic therapy and seeing how far we've come in the past few decades, it begs the question to where we will be in several more. The exponential progress we're making, both intelligently and technologically, makes one hope that one day cancer will be as easily treatable as the common cold. Thank you.